see it. Okay, so let's run around quickly. If you've got any updates, I mean, I think we all know each other, but mostly we're interested if you've got any updates you'd like this group to hear. And I'll start with Matt now that we know that he's here.
No updates, but I'll be in the Jefferson Healthcare Jefferson Healthcare booth at the fair on Sunday. If anyone wants to say hi.
Okay, everybody's.
Are you gonna have any good? Are you having any free handouts?
I mean, we always have some stuff. I don't know.
Yeah,
what you like.
Okay, you need to come to these meetings prepared with what your swag is going to be.
Yeah.
So.
Right,
Dr. Carlbaum.
I will send you, Lori, a link to the Washington State Poison Control Center Overdose Prevention, Harm Reduction, and Treatment series, August 29 through 31. Looks like some cool classes, including things like Don't Trip, Magic Mushrooms and Psychedelic Medicine, and Club Drugs, and Understanding the Experience, Knowledge, and Perceptions of Counterfeit Drugs in the United States, or The Adulterant Adventure. So looks cool. All online and all free. So I'll forward that to you to send to the group. And I think I was trying to think other updates. I had a wonderful recorded conversation for public health for a harm reduction video with Gabe of Whale Heart Productions, maybe videographer, shepherded by Anya. Wonderful, interesting, thoughtful discussion about harm reduction. So hopefully some interesting quotes in there. So can't wait to see it.
We're going to be excited to see how all that gets slices together, because Gabe is so talented at making something good, and it sounds like you guys gave him good raw footage to begin with. So thank you for giving your time to do that.
Of course.
Patrick Johnson.
Oh, yes. Good afternoon, everyone. NAMI, Jefferson County. We're very excited because this month we're rolling out a brand new stigma reduction program. We received generous funding from the Accessible Community Advisory Council, which is staffed by the health department, and we put in some bucks, and so we're going to have videos and literature and the whole bit. So stay tuned for that. We're very excited about that. Well,
great. Sounds like all kinds of things going on in your corner.
And no swag, although I do have some stuff. I have leftover t-shirts if anybody wants any.
All right, you just all check in with Patrick if you want a t-shirt. Barb.
Thanks. I need volunteers and I need money for our firearms safety event, which is on September 23rd at the Quilcene Community Center. We're handing out free trigger locks. So let me know if anybody has money or volunteers to offer up. I'll work on the swag, see what we can do on the swag. Seattle Children's Hospital is our partner, and they might have the swag covered. So I'll check in on them.
All right, on that. Right. Okay, check in with Barb if you want to volunteer down in Quilcene, which is beautiful this time of year. What's the date of the event?
September 23rd. So we're a little bit ahead, but for coordinating the volunteer and money aspect, we are coming up against deadlines.
Yeah, I hear you. Sheriff Null.
Yeah, Joe Knoll, Jefferson County Sheriff, and don't really have anything to report other than I just got back with a couple other people here from the Discovery Behavioral Healthcare Employee Picnic, and it was quite well attended, and things are good at DBH. And no pressure on you, Matt, but I always think that Jefferson Healthcare usually has some pretty good stuff at the fair, so be seeing.
Throwing down the gauntlet, you got to live up to whatever it was last time. Lisa Grundle.
Hey, it's Lisa Grundle, Health Facilities Planning. Not a lot of updates. Looking forward to digging into data when we get some of the updated data back, but other than that, not much.
Thank you. Good to have you here. Apple.
Hey, everybody. Just to mirror what's probably already been said, thank you for your patience if you've deployed it with regard to the county and all of the email black hole that we've been in since last Friday at 10 a.m. We hope that you've seen our messaging on social media, on our websites. We're trying to broadcast this information as much as possible to as many people as possible, making a lot of personal phone calls, which is kind of nice, nostalgic way of interacting with one another. I think it actually improves my mental health to do that. It's nice in a way to take a tiny break from email, but it's also been a world of consequences that we're especially seeing late yesterday and today as we do come back online, but only in specific layers. So not everybody has all the usability of email yet, and it's having cascade ripple effects on some of our software and other ways that we plan and communicate with people. So please bear with us. Other than that, I think I'll just reiterate that we're going to be, as Barb said, we'll be at the All County Picnic coming up shortly on the 20th, and we'll be doing all the wonderful things that she said. And yes, we have a lot of swag. We understand that that's what draws people. And I do know that this particular event this year, as it comes back online more full-fledged after the pandemic, I think there's a ton of vendors and I'm excited about it. It really is an emergency preparedness sort of event. And they're encouraging families and more children to come. So there's a lot more emphasis on demos and things to try, and interesting raffle prizes that really speak to people being conscientious and communicative about how to prepare and take care of themselves in the event of an emergency. Speaking of emergencies, there's heat on the horizon. So we have had some heat this summer. About every Thursday, I feel like there's a little bit of heat cropping up on the weekend when we're not typically operational, although we do have a contingency of folks at Public Health and Department of Emergency Management in the county who work every week to try to monitor and see what type of response we might need for people who are less able to access a cool space of their own in terms of retreating from heat, should we have a heat event, and or struggle with clean air, should we have poor air quality or wildfire smoke. So I bring that up because we work on that quite a bit, and you may not see as much of that, but I think it's relative to behavioral health because it definitely inordinately impacts people who are, you know, more marginalized and have less access to resources. So we're trying to deploy actual cooling centers and other resources to areas where they may have less access to those supplies. I think that's all I'm going to say for now. Glad to be here.
Glad to have you here. All of it important stuff. Thanks for sharing. Commissioner Brotherton.
Hi, everyone. Greg Brotherton, Jefferson County BOCC. You know, my big update, I think, is on the agenda later, so I'll wait for that conversation there. And just, if Barb, I might not be at the gun event, but if you can get any emotional trigger locks, I will be there. Absolutely.
That's the swag he wants.
We
Greg.
can do a sidebar on that one.
Cherish.
Hi, good afternoon, everyone. Coming to you from our Port Angeles office today. Thursdays are now my day over in Port Angeles. So just want to thank everyone for being here. You know, unfortunately, we had someone pass away at one of our housing facilities. Want to thank our partners for, you know, helping our residents and folks deal with what was a long-term resident who took his life, unfortunately. We are, as you might have seen in the paper yesterday, legal notice went out, notice of the public hearing for the Mill Road project for the shelter phase 2 and phase 3. And so there is a hearing examination date that is set for a public hearing. So that's, the notice is in the newspaper. Comments have to be in by the 23rd. The meeting is going to be over Zoom, so people can join. You know, thus far, we're not anticipating, you know, too much negative comment or press, but we always appreciate, you know, having the support of our partners in these types of ventures. So if I've got any links there, I'll share that in the chat. And if you're inclined to just, you know, maybe write something of support, you know, essentially we had to prove, do a lot of pre-planning that, you know, we weren't going to pass SEPA review and then, ensure that we were not having a dramatic effect on the changes of traffic in that realm too. So yeah, so I think those are the two big things. We're still on schedule to try and get that congregate facility, built by August, September of next year. So trying to get in before some of the building code changes. So that's what we're trying to deal with. And as always, we appreciate your help in continuing to keep our partnership with the American Legion alive, because that is strained. And so we want to ensure that, yeah, we're all sort of pitching in to make sure that we keep our partner happy there, our landlord happy. So thanks. Good to see everyone.
And then just to confirm, is the hearing date on the 24th then, if the comments are due by the 23rd?
No, the hearing is actually on the 29th.
On the 29th, thank you.
Yeah.
I'm sure I could go find the newspaper.
Yeah, no, I'll put it in here for you, so.
Perfect. Thank you. Richard Davies.
Afternoon, everybody. Nothing new here. Glad to see Rebecca Marriott, who is our new treatment coordinator here. Yeah, excellent. I see you all.
Great. Nice to have you here. Cassidy.
Hi, everyone. Cassidy Chang, Population Health Coordinator at Jefferson Healthcare. Nothing new here as well. I'm sad I won't be able to make it to the Jefferson County Fair this weekend, but I hope it's really great and you all get your swag.
We miss Adam. Is he around or is he off on vacation? Do you know?
He might be off on vacation right now or very busy with data stuff.
All that data stuff. Rebecca.
Hello. I don't have a ton of updates other than we were able to hire a peer support specialist for our therapeutic courts. So they have joined the behavioral health court team and are available to join the drug court team. So we have some lived experience on our teams, which is great. And she's jumped right into her role. So glad to have her.
Great. That's good to hear. Thanks for being here, Rebecca. Jim Novelli.
I know there's more discussion later in this agenda, but I am grateful and thankful to what transpired this past Monday and the collaborative nature of sitting side by side with Apple at that meeting. It was great. And I look forward, I'm happy that the BHC is going to live longer and move forward. And I think it's going to be a big deal for this county moving forward. So now I'm going to recover here from a day of picnicking. So I'll sit back and be quiet.
Picnicking is work. It's lots of stuff to be dragged around. Chief Black.
Yeah, just kind of recoiling from some emergency events. We've had a couple significant fires, wildfire and a structure fire and a couple other incidents. And then we also had a great presence at the farmers market where we had sidewalk CPR and shared a space with Anya and her program. And now we're spooling up for the fair tomorrow through Sunday. You'll see us there with a big lot of swag and a lot of activities for kids. So bring your kids and grandkids. And then after that, we have the all-county picnic. And then we have Fire Prevention Week celebration, October 14th. We'll be doing the very similar presentation that we did last year, where we kind of close off some of the streets in Port Townsend and celebrate the fire service and try to keep everybody safe. Other than that, yeah, we're kind of still holding our breath on a couple grants for extra firefighters, and all that comes to mind.
Well, it sounds like you got a lot going on over there. And good swag. We always like the fire department swag. Thank you. Anna McHenry.
Hi, thanks everyone. Glad to be here. I really don't have any updates. I'm looking forward to connecting and hearing what we're doing today.
Great, thank you, Anna. Good to have you here. Gabby.
I do have a couple updates. One is an update through OPHS and our partnership with them. They were able to hire a psychiatric mental health nurse practitioner that's available to see any clients, not just people that are on Suboxone. So that's exciting. She can see anybody 12 and over. She does bill Medicaid. So that's good. The other thing is our nonprofit branch, Gateway to Freedom, is launching our lead program effective Monday, which is a pre-booking, pre-court diversion for low-level law violations. We've been working pretty close with the prosecutor, police chief, and JCSO, and Richard Davies and the National Lead Support Bureau in order to get some pretty solid policies in place. Feel pretty good about that. And that starts Monday.
You've been so busy, got so much done.
Yes.
Thanks for being here in the midst of all of that.
Yeah.
Stephanie Lewis.
Good afternoon, Stephanie Lewis here, excuse me, with the Salish BHASO, filling in for Miss Jolene.
Good to have you here. Thanks for filling in. Jolene is taking one of her kids up to Alaska for college. You all remember how emotional that can be. All right, Lisa Ray Thomas, it's so good to have you here.
Hey everybody, really great to see you. I have missed you. My last day with the UW was July 14th, so I'm fully with Washington State University now, and we have a weekly meeting that conflicts with this one, so that's why I've been absent. Really sorry about that. One of the projects I'm working on is the Rural Opioid Training and Technical Assistance Collaborative, and we have a webinar coming up August 30th on fentanyl and xylazine. So I will send you guys that information. And my grandson turned 1.
Oh, that went by so quick.
Really great to see you. Thank you.
Well, we will look forward to getting the notice about the webinar. It's a topic we were just talking about it this afternoon around the table. So yeah, thanks so much for thinking of us and including us.
And congratulations on the support to continue the BHC. It's really awesome.
Thank you. It was the work of a lot of people you see here, a lot of people behind the scenes. Okay, have I caught everybody in the introductions or updates? Looking. All right, I'm going to move on to our agenda. Of course, we're going to talk about the BHC sustainability, and it's sort of got 2 components to it: the no-cost extension, a little explanation of what that's all about, and then talking about the opioid settlement funding, which I'm glad we've got some good people here who can speak to it directly. And then a quick reminder that our PIMS report data will be due on September 15th. So this PIMS report goes from March of 2023 through the end of August. So I'll be reaching out to talk to you guys about that individually, those of you who know who you are. Then we've got a link, as you'll see on the agenda slide, to the Padlet, which just has a lot of stuff that maybe you're interested or maybe you're not, but it's got the full documents for the no-cost extensions. It's got links to interesting things that we're looking at for the future in terms of community engagement conversations. It's got budgets, all sorts of things. And if any of that causes you to have questions, feel free to reach out. Just wanted everybody to have it at their fingertips. And then just a note, our next Behavioral Health Consortium meeting is going to be on November 9th. And I'll say that again at the end of the meeting. So is there anything else that folks would like to make sure that we check in or chat about before I jump into our agenda? Okay. I'm trying to decide if I should show my screen. Do you guys all have links to the presentation and can look at it yourselves? Sometimes it's hard to both read people and look at the, okay. So the quick overview on sustainability, and I'm on slide 4 now, is that we did get the 12-month no-cost extension approved by HRSA. And while that doesn't allow for additional funding, it does allow us to complete some projects and then give a summary report after we've completed everything, which is much better than giving a summary report when you haven't finished everything. We'll go into a little more detail on that. And then the next piece of the sustainability overview, the BOCC hosted a workshop with key players earlier this month and ultimately approved a portion of the opioid settlement funds in the amount of, I'm putting it around 50,000 a year to be allocated to DBH for 16 years. DBH will act as the pass-through to retain support services for the BHC to function in this leadership, planning, and coordination role for Jefferson County around prevention, treatment, and recovery in response to the opioid challenge. So those funds are very specific about what they can be used for. And this one piece of it, that leading, planning, and coordination is one of those pieces. We'll get more into the details and open up for discussion on that topic. And then, of course, in terms of sustainability, we do plan to continue to work to identify and pursue grant funding on behalf of the consortium as a whole to support whatever it is that collaboratively we have decided are priorities for the county to improve the county's behavioral health system. So that's the quick overview. If you miss everything else, you'll have at least gotten the high points. On slide 5, the no cost extension, there's some key activities that we're going to either just nod an eye to or complete. One of them is we had just purchased a transportation vehicle. We didn't, Owl 360 purchased it, and now they are going to be able to use it through the no cost extension period, which goes until August of 2024, without the concern that HRSA might want them to relinquish the vehicle back to them. So that just guaranteed us another year of being able to use that vehicle. And then we're going to be working to restore some data integrity around some law enforcement data that sort of went through a bit of a mix-up from the June 2022 timeframe until the beginning of our last period, which I think was September. Is that what it was? No, March. In March, we discovered that there was some data that we wanted to clean up there. So we're going to go ahead and get on that now that we've got the no cost extension. All of that will be fed in then to the new data, the block of data that we're going to be collecting. And in November, we'll look at a full set of data from June or from the whole time that we've been collecting data up until the end of August here this month. So I'm excited that we will have time with this grant to make that cleanup happen. And then we're going to continue working with the community engagement piece so that we can install multiple smaller naloxone boxes in different places, transportation, libraries, various locations throughout the city and county. And we want to be able to really engage with the community before doing it in all of these different places. So that year gives us some opportunity to make that happen. And then we'll complete all of the grant reporting requirements, which are a bunch of reports are due here at the end of September. And then there'll be a final report due at the end of the term of the grant out in August of 2024. So this basically, I feel like know that we didn't get more money to do the work, but we're just going to be able to do the work that the grant gave us the money to do. So we're pretty happy about that. And then some of you might be wondering what will be happening with the South County harm reduction table. And while I don't know the answer to it, I'm kind of excited about how we're about to get to the answer. And that is Holly Gum from Jefferson County Public Health, who is she's the Quilcene Empowered Teens Coalition person. And she and Scott Waller, a gentleman from WSU, are going to facilitate with that South County harm reduction table a ripple effects mapping session. And you can see on slide 6 what that session looks like. And then they are going to map the session, go away and do some, there apparently is some sort of a system that they put all of the answers into and get out some sort of a report that they'll then come back and share with us. And I think the feedback from that will give us a sense of how do we want that table to continue. And it will also give us a baseline that a year from now, we can go back and do that same thing again and see what sort of, if we were able to make the evolutions that we determined were useful back at this time point. And then going on to slide 7, next steps with the data group, we're working to set up a time slot in October where we'll get our data subgroup together. go through something similar in terms of a process where we're asking ourselves question, determining what we want to do going forward. I'm pretty sure it's going to involve some data charters and some data memorandums of understanding that will get set up as we move into this next phase of the consortium. But we will start to get that galvanized there at the October meeting. And for those who are on the data subgroup, we'll be reaching out to you to make sure that you can make whatever time slot we set it at. And then I have some slides here that cover the opioid settlement funding, and I'm wondering, I can go through them. I'm happy to have Apple or Greg or both of you speak to them as we go through. So I just want to step back for a minute and say, does anybody want to speak to them, or I will bore you and take you through them in my semi-monotone voice?
I was just thinking your monotone voice is quite right and quite nice. I'm sure I can chime in at times if I feel the necessity, if that's okay with you, but I've reviewed the slides and think you've done a construing of them. Thank you.
All right. So as many of you know, there's all of these lawsuits and opioid settlement funds that have made it into Washington and now coming down from the state into the counties. And just to give a little bit of clarity about how they're coming into our county, I also should stop for a minute and say we also have Stephanie Lewis here from Salish Behavioral Health Advisory, and she'll be able to speak to anywhere that there are questions, because I'm imagining there's questions and discussion that we can have on each of these slides. So the Washington State opioid settlement funding came into our region, which is Jefferson, Kitsap, and Clallam counties, came into the SBH-ASO, which is serving as our regional opioid abatement council. And I think, somebody correct me if I'm wrong, that each area had to have an opioid abatement council set up before they could receive the funds, or at least that was the game plan. There have been funds, those funds that will be coming to Jefferson County. It has been decided that they will come in one disbursement a year into Jefferson County Board of County Commissioners, who will then disperse them. Part of them right now, and we'll look at which parts on future slides here, will go to the Behavioral Health Advisory Committee, which administers the 0.1% funding, and they will disperse those funds via RFP, maybe even targeted RFP, as the funds come in and as they do their RFP process. And I've included a link in I'm pointing to this like you can see it. I'm going to share my screen just for a second. The link that you see here for the One Washington MOUs Exhibit A, that talks about all of the things that the funds can be used for. And so as the BHAC is RFPing out those funds, that's the specifics of what they'll be looking to answer and to share those funds around. And then the other part of the funding is going to go into Discovery Behavioral Health, and they will pass that through to the BHC, basically to staff the BHC and to keep the table open. And I'm thinking a website and just the costs associated with keeping that table open. And then on our next slide, this gives, it's an overview of the estimated annual payments. And while I should say this is complete as of this moment, there are likely to be more funds that will come into this part of the specific funding pieces that will go to the BHAC. So more funding that comes in beyond what you see right here, I think at this moment we understand will go directly to the BOCC and then to the BHAC to distribute out. And then this amount, which is called the distributor column, and I don't even know why it's called the distributor column. Maybe Stephanie can explain that. This amount will be in a yearly amount parceled out to DBH, which will come to the BHC. Stephanie, do you want to talk at all about any of this?
Just briefly clarifying why it's called the distributor funding. I think an attempt to have some clarity as to the different types of settlements that are being reached over time. And so the first settlement that was reached with the state was with opioid distributors. And then subsequent, which was on the middle to right side of that spreadsheet, often referred to as pharmacy settlement or Walmart et al. And I'm sure many more names to come in subsequent years with, subsequent settlements.
Thank you, Stephanie. Greg?
Yeah, I'm just wondering if Stephanie, if have any idea about future settlements. We have, of course, haven't seen manufacturing and, like the big Purdue money and stuff like that. And I'm wondering if you have any intel on what the future, it'll all be dictated by that same MOU, all one Washington MOU, but do you have any intel you can share?
So I am aware that there are ongoing conversations. I do believe some of those conversations are with additional pharmacies. I'm not familiar with which pharmacies those might be. I'm not at those tables. And it is anticipated that there will be more settlements, whether it's in the months or years to come, and probably several. So I know that's not really definitive. And I can also prepare prior to the next BHC, the next time I get an update from legal counsel, how much I'm allowed to share. Yeah.
Great.
And
Thank you.
I would just add to that, as you could see in the spreadsheet, the years under each pharmacy are variable. So there's those particular pharmacy settlements total a 14-year period, but each one has its own duration of years that it can be used. And it's likely that any subsequent pharmacy settlement to add on to that in the months or years to come will also have variable year durations, so to speak. So we just have to use that variability in our calculus ongoing.
So while it's a good activity to have, there's going to be some complexity to it, it sounds. Yeah. Yeah. Are there any other questions from the group as we sort of talked about how they come in, how these funds come in and what the funds are and how they'll be split? I'm looking at Lisa Ray Thomas, who's noting that the governor and legislature set aside just over 20% of the first round of abatement settlement funds coming to the state for tribes and the 2 urban Indian health organizations. It doesn't affect the funds coming into the other counties and regions. Thank you, Lisa. That's good to understand.
And another detail is that some of this money goes directly to the state before it's allocated out to counties. I don't know if you said that, Lori, already, but that's an important feature to remember.
Yeah, 50-50.
I had a question on that. Does the state use that money just like to administer the program, or will they actually be investing that into opioid abatement, if you want to say programs? Do you know?
They're required to use it on the attachment E or whatever that was called that Lori just referred to. So there are allowed activities. There are a number of activities. I think there's like 120, but they have to all be used for addressing the opioid crisis.
Okay, thanks. So it's just not the state taking a cut of the settlement.
Correct. Yeah, they're not allowed to.
Okay, thanks.
And the legislature, I believe, has already allocated the funds in buckets.
Thank you, Lisa. Stephanie?
Yeah, I just wanted to add to what Lisa Ray just said, and I agree with everything you just said. So yes, 50% of the settlement was awarded to the state and is being administered by either or both the Department of Health and the Healthcare Authority. And the last biennial budget, a significant amount of that opioid funding can be seen as the fund source for multiple initiatives. And another interesting development is the Washington State Healthcare Authority staff person that is primarily responsible for managing those funds will be attending or has RSVP'd to attend the Salish BHASO Executive Board meeting in September to provide a presentation and respond to questions from the commissioners and other board members. So it's an open meeting if folks want to learn.
No swag, but really good information.
Might have coffee, but that's our swag.
Let's see, I saw somebody else with their hand up. Patrick, maybe, did you have a question
Well,
or a
with
thought?
respect to the advisory council, I see Anna's here. We can take this up in the advisory council, but I'm just curious if we'll change the if we'll need to change the RFP cycle. We're on a 2-year cycle now, but that's an operational issue that we'll need to take up.
I think that we're going to learn more about the, these funds and, excuse me, turn this fan off. And some of the regulatory aspects of them, which is different than the 1/10 of 1%. So we may be doing a different cycle of RFPs. And we also need to be able to do some planning ahead as far as where the gaps are in our community and what are the needs. And so we're going to be relying on partnering with the BHC on that to make sure that maybe we need to do a targeted RFP for certain services.
I think that's a great idea, the targeted RFP. I liked when you brought that up at the meeting, Anna. Okay, any other questions on that piece of the discussion? All right. So we've already started to tiptoe into this conversation, but one of the things that's really clear is this gives us a really good opportunity to build on the respective strengths of the Behavioral Health Advisory Consortium Committee and the Behavioral Health Consortium. And I've written a few things here of what the BHAC does, but I'd welcome Anna or anybody who wants to speak to specifics of what you bring to the table in terms of your strengths that you're thinking about as you think about how we can link ourselves up. I've put a few on slide 10. Just to give an overview, they distribute the 1/10 of 1% funding and have been for a long time. They have a dashboard and collect data specific to the folks that they've given funding to, so that data is reported on. And I included some that I just know this is not at all an exhaustive list. What you see in I know there's also data that's collected for school-based health clinics when they fund mental health counselors in there. So there's a range of data that they keep and watch over. And now they're going to additionally take on this complexity of all of the funds that are coming in from the Opioid Abatement Council and begin to get those out under the specific guidelines that have been laid out. And it sounds like the timelines and the amounts are going to be varying. So it will be a lot to keep track of. So that will be a big job. And then of course, on the consortium side, there's what we have been doing, which is this collective effort to build a seamless behavioral health system that allows our community members to navigate smoothly to the needed services. And that sounds very smooth, but it's actually the fact that everybody is at this table that allows us to kind of look at it from above our silos or below our root system and look at where it is that we can shore ourselves up and fill gaps. And that's something that we want to continue to do more of with the groups, the different agencies and organizations that make the time to come to this table, which we really appreciate. We also do collective data analysis. So we gather data from the EMS, law enforcement, hospital, various service providers, and have been over a period of time. So we've got some interesting roots down, at least in the pre-hospital area, that I don't know that that's data that's being collected anywhere else. And then of course, all of that PIMS data that you guys give us that we're going to try to continue collecting going forward. That also might help us if we go after other HRSA grants. The fact that we've already got a backlog of data or a vault of data, I think might serve us well as we pursue other grants. And then we'll just more fully step into this leadership planning and coordination role with Jefferson County and have more of a linking communication and sharing insight generation between ourselves and the Behavioral Health Advisory Consortium, so that we're looking at the system as the whole, and the BHAC is having a chance perhaps even to do some targeted RFPs toward things that we really want to get funded, that we recognize as a community. Are there any questions on that? Apple?
Not too much a question, but just a comment. I think it's valuable to sort of lay out the entire sort of landscape and in these different ways that you detailed that. So thank you, Lori. And I would just add a nuanced layer that the BHAC, while in this construing of the way that the funds are coming through and the way that we've interpreted the One Washington MOU, as you aptly pointed out, the decision that was made on Monday was for the BHAC to really harness its already well-oiled machinery with regard to RFP processing, collecting data, engaging the vendors in data rapport, and thinking deeply about it. And also an advisory committee that really works deeply with understanding what the gaps are and where these fundings makes the most sense. And then the BHC, obviously we're all here. We know the bennies and the value of what this table has brought. And I just want to be clear that the BHAC also has its own administrative policy and leadership qualities. And even though in this construing and the way that we've looked at the MOU and sort of said, this money could go here and this other money could go there, each table has elements of what the other table is doing. So I just want to make sure that everybody's fully aware of that. And I personally just want to say to this group that I think it's I think what's going to evolve here is something really innovative and new. And I'm excited about it for many reasons that are obvious, and also other subtleties that I think will just improve the collaboration wherever it needs to be improved. And also the sharing of information, as well as looking at what's needed more wholly, so that we can all together collectively create a better behavioral health system here for people who need it to access. So thanks for bearing with the process and for also taking in all this information today. And I'm making a nod to you, Jim. It was really powerful to sit with you and have that discussion on Monday. And I appreciate the thinking that we're doing together to evolve the process here.
Well said.
Thank you, Apple. Any other thoughts on that piece before we go to the next slide? Okay, go ahead.
This is Anna. I just wanted to say that the data that we've been collecting, and I'm happy to just show it really quick, that I think that it might be helpful for the Behavioral Health Consortium to take a look at this. And if there's some areas that, we're not capturing that maybe we should capture with our epidemiologist or with our vendors to share that with us as we move forward into this new contract year.
You might drop the link to that report that you just showed.
I'm not sure I know how to drop a link, but I could definitely email it out.
Oh, that'd be great. Thank you.
Okay.
Thank you. So moving forward, one of the things that came out, Sheriff Knoll.
Yeah, I'm sorry. One thing I noticed on the chart that Anna put up, I thought it said something like unduplicated services or something like that. And I don't know if this ties into that, but one of the concerns I've been having lately is we're starting to get so many different navigator type programs in the county that we need to I think we need to make sure we're using that to our best advantage and not everyone running off in their own direction. So however, all of us working together, could make that happen or work on that, I think would be great.
Thank you. Patrick?
Yeah, thank you. And much thanks to Anna and the folks who collect that data. We're really good at collecting quantitative data, and it's much more difficult to collect qualitative data. How do we know that we're making a difference? And we have anecdotal information, and that's tough to do. And I think there's no easy answer for it. But I think that's something that, well, I know for a fact that we talk a lot about that on the BHC. And we always ask the vendors about that. So anyway, just to put that out there. So because we know quantitatively what we're doing, we'd like to know a little more qualitatively. And my gut instinct is that the vendors are doing a good job. But anyway, something to think about.
Yeah, and there's kind of a combination. And Gabby, did you want to say something?
Yeah, just real briefly.
Go ahead.
I think that a lot of the like navigator type programs actually provide similar services, but they're not the same. And I think it's more of a collaborative effort than it is like us as navigators or DBH as navigators or the sheriff navigator, the police navigator. You know, we all have to kind of work together. And I don't really know that any of us are exactly duplicating services that the other providers are providing, because we all kind of, we're a small community. We all work with the same people. But we all kind of provide something slightly different. And sometimes it takes all of us to make that happen for somebody.
Thanks, Gabby. I know one of the things I'm excited about is maybe at this table, we'll be able to sort of sort through if there's any places where we feel like we're duplicating. We'll be able to untangle that pretty easily. When I think about duplication, I think about duplication of data. Like sometimes it's really hard to know, is that a single individual that I've seen 7 times, or is it 7 individuals that I've seen once? And that is a very complicated thing. And it can mean really different things depending on which way it goes when you're looking at something in terms of trend analysis. So that's something that that we know we need to think about in terms of data that I know our data subgroup will be taking on. And there's a few other sort of data things, just good coding. I think there's a real opportunity for us to do training with, any of our pre-hospital folks in how we code the data that we're collecting so that we actually do get insight from it, as opposed to a more random approach to how we've coded it. So great opportunities for us to shore that up. On to slide 11. One of the things that came out of the discussion at the BOCC on this topic of how we will work together moving forward is they'd really like to see a memorandum of understanding developed that explicitly defines the intentional ways that the Behavioral Health Advisory Committee and the Behavioral Health Consortium will work together and be linked going forward. And a few changes that they noted was that it'd be great to have a consistent BHAC member that attends the BHC meetings, so that we are making sure to do our, to keep each other in the loop. And I think the same would go the other direction, consistently having somebody from the BHC going to the BHAC meetings. And then getting to that data collection effort to generate collaborative insights and analysis, however it is that works out, to make sure that we're looking at each other's data in ways that allow us to generate insight and then to take that into our priority setting discussions, and then going out and funding whatever those priorities are. So some conversations to be had as we try to work out what that looks like going forward. Are there any questions or thoughts that people would like to share about that topic? I thought there'd be so much discussion today.
Yeah, Lori, this is David Carlbaum. I think having a representative from each group on the other groups' meetings makes a ton of sense. And, we've had that to some degree with folks from BHC here, or people who attend that meeting here, but I agree, a more formalized process. And then I think the data is interesting, and it's like right now the data sets have progressed and matured independently. I worry about merging them. I'm not sure I would propose a merge of all the data into one quite yet. And I'm excited to start to think about a little bit more advanced thinking about how to sort out individual clients versus separate repeat visits. I think that's really complex. And, I shared a document with you about using a Bayesian probabilistic methodology that's used by EMS in King County to try to do this. And so I think there's ways to do it. It might just take some pretty advanced statistical coding to do, but I think it's quite possible.
Mhm.
And so I would vote that leaving the data as they are in their current form and as they mature, and then using them to inform and you know, for special projects, if we need to merge data sets or look at the things in both data sets, I think that's great.
Mhm.
I think that's where a lot of innovation often happens. I see that in medicine, where someone has a data set of cardiac arrest and someone has a data set of lung disease, and you can merge them together if you want to look at the nexus of that. And so I'm excited that both groups will continue to keep their mature data, think about how to improve it. And I think you're right, at the coding or input level, there's a little bit of stuff we need to work on, both for firefighter EMTs and I think for law enforcement, for police officers and sheriffs to be accurate. And then maybe we should try to figure out how to move beyond people's impressions and use objective data. So for example, opioid overdose, perhaps we should use objective data out of the charting system rather than someone's impression.
Mhm.
I think that could be really interesting. So,
You know, as you're saying that, I think it'd be interesting to have, you know, so we collect our data, but Lisa's really our data guru, right? I'm not your data fiend. And the folks at the BHAC, they have somebody who helps them with their data. And I think it'd be interesting to have those people at each other's meetings so that we're making sure that the minds who really do understand what we're looking at are looking at it together, looking at our two datas and where they intersect and where they support and supplement each other.
yeah, and making sure we have common definitions for certain things.
Yeah, yes. And so just starting at a baseline of what are our definitions and then going from there and looking for it. Yeah, so there's a lot of great opportunity and good work that it can be done there. I think, you know, I can see Excel spreadsheets in my future and I'm very excited about it. But I have to admit, what did you call it? What kind of, was it Bayesian? The Bayesian. Okay, yeah. So tell us just generally what that is. Like not deep, just what it is, because
In general, in the world, there are two. You're going to make me do this in front of Lisa. There are two forms of statistical methodology. One is called a frequentist. So like I measure how often things happen in a population. One is more probability based. So if this is my whatever probability and there's a likelihood ratio of this is my post probability. That's called Bayesian, I think named after some old white guy with a beard. Not Patrick and not old, but you do have a beard.
But I'm not old.
Thomas Bayes, maybe. And it's a newer way of statistics that I think is gaining a lot of interest, certainly in medicine, because oftentimes the question of if a population, if I do this, does that helpful? That's not the question I want as a doctor. I want to know in my patient, if I do this, is it helpful? And I think the methodology is basically about using probabilistic matching. When you have two records of the same human, do they match enough that we can with confidence say it's the same human? Please correct me, Lisa, if I'm wrong, or make that explanation better.
so close.
I know lots about data, but not about Zoom apparently, because I couldn't unmute myself, losing confidence in me. Yeah, I would want to learn more about it myself. Actually, we have been delving into that. I mean, I think in general, a lot of healthcare data is delving into these kinds of things where we can use some estimates and probability to be able to get to closer, because there is, especially in behavioral health, but I think across the board, so much duplication, and we've seen it in behavioral health. The same person that gets picked up by the police might end up in the ambulance, and then might end up in the ED, and then might end up in primary care. And so how do we use some probability data to help us really get a better handle on eliminating duplication? I think it'd be great. And I would love to talk to King County Public Health. Is that who you said was working on this? Because they have some people that can run circles around me there, and we've worked with them on other things, and they are fantastic. So I would love to loop them into these conversations and use their brains too. They've done some really good work there on some of this stuff already. So
Right.
it's exciting to think about. Yeah, for sure. And I think they'd be excited to see the data we're collecting, because I think Jefferson County is unique in that way, in all the different places that we are collecting really good, strong, mature data. And so I think that would be a exciting thing for them to delve into with us as well.
Well, okay, data's in our future. On to slide 12, I just outlining what the next steps are. So we've nailed the NCE, we've confirmed some seed funding to keep the table open. We're going to be this month collecting, or at the end of this month, between September 1st and 15th, we'll be collecting the new HRSA PIMS data, and I'll be reaching out to you with some standard questions that they're always wanting me to get information from everybody on. So that'll be a big effort happening in September. And then we're going to give all of that to HFPD to analyze along with the restored data and with the past data. And in November, we plan to give a presentation that's sort of a milestone of where we're at and what trends we're seeing. And I don't know how that fits or if it's useful at all with the BHAC in terms of where you're at thinking about money that you're putting out. Is there money that goes out this fall? No, so don't have to worry about it this fall. We're going to work on generating in the contract between the county and DVH for the settlement fund and the MOU that structures the BHAC, BHC linkages. And honestly, I don't know how long that will take, but right now we do have a no cost extension that while it isn't paying for a lot of my time, we're going to keep things going. We're going to keep things knit together. I'll be reaching out to all of you, I'm sure more often than you wish I would. And so don't think that you're getting rid of me until November. That's not going to happen. We will be working with the South County Harm Reduction Group to discover what our next steps or determine what our next steps are going to be, have that data subgroup meeting. And then this is kind of far out there, but I'd like, of course, we have 2 minutes. If you can think of somebody that we should be looking at recruiting either for a partner role, which is more of a voting role, or a cooperator role, which is more of a be here in an ad hoc way, but bring your insight and knowing to the table. I would welcome having those put into our chat or emailed to me at some later time when you have time to think about it, because the process of recruiting, I think, needs to start happening as we start to discuss what it is the BHC is going to be moving forward, because we want those new people, if there are new people, to be a part of that discussion. And thank you, Lisa Ray Thomas, somebody from Jamestown Healing Clinic. I know they're not Jefferson County, but I think a lot of our Jefferson County community, not a lot, but community and residents do go and use those services, and it would be great to have them at the table. Lisa Ray, if you had in mind somebody that I should start with, it might just be, I can't remember her name, who was the leader of it, executive director.
Molly Martin.
Molly Martin, yeah, I'll start with her. So other folks, and then if you want to see the sustainability work groups recommendations, the link is there on the slide. Remember, there's HRSA offers peer support, and they will continue to offer peer support. So the link is on slide 13. Our next meeting is on November 9th at 3 p.m. on Zoom. I'm going to send out a link here shortly. Is there anything else anybody would like to say or contribute before I let you all go at 4 on the dot?
Lori, I just want to say thanks to everyone here who contributed in the meeting Monday or wrote letters of support, even though I know those may not have made it yet. I think this group is amazing and doing amazing work, and reflecting back on how much is have accomplished in the past 2 years. It's pretty impressive for a group that was gathered just to collect some data for the feds. It seems like it's done so much more than just that. So thanks for your leadership, and thanks to everyone here who's continues to participate.
Thank you. Thank you. If you guys see folks that you do not see at this table today, and we want them here at the Port Townsend Police Department, we'd like to see data folks and Dunya from the hospital, let them know we miss them at this table and that the table's going forward and we need them here. All right, that's all I got. Have a great afternoon, you guys. Bye-bye.
Thanks, everyone.
Bye.